Good morning. My name is Sherry Reed, and I am a graduate student enrolled at the University of Texas at Arlington. Today I will be presenting a case study on the topic of Clostridium difficile infections for senior nursing students. Students were given a copy of the case study and research articles 24 hours prior to this presentation to use as resources to achieve learning objectives. Students are expected to actively participate during our group discussion. Okay, so let's review our learning objectives. 1. Upon completion of this case study, 90% of students will be able to list 3 risk factors for developing C. difficile infections. 2. Following completion of this case study, 80% of students surveyed can accurately summarize the relationship between antibiotic usage and pathophysiology of C. difficile infections. And finally, upon completion of this case study, 80% of students will demonstrate proper donning and doffing of personal protective equipment to prevent the transmission of C. difficile infections. First, I would like to ask students if you experienced any difficulty with understanding the assignment or any issues with meeting the course objectives?
No.
No? Okay, great. So let's begin. Mr. Smith is a 73-year-old white male who presents to the ED with complaints of generalized weakness, abdominal cramps, nausea, and 5 episodes of diarrhea during the past 24 hours. According to Mr. Smith, he was in his usual state of health until approximately 3 weeks ago, when he was diagnosed with a UTI and treated with oral antibiotics, which he completed 3 days ago. According to Mr. Smith, he is no longer experiencing pain during urination and is able to void without complications. His medical history includes hypertension, GERD, and BPH. Mr. Smith retired at age 69, owns his own home, resides with his wife of 39 years, has no children. He denies history of alcohol, tobacco, or illicit drug use. As far as his family history concerns, his mother expired at age 83 with an MI. Father expired at age 77 due to a motor vehicle accident, and he has no siblings. His current medication regimen includes metoprolol, aspirin, Prilosec, tamsulosin, and furosemide. Past medications include ciprofloxacin, 500 milligrams BID times 14 days. Upon physical exam, it's unremarkable, except for complaints of tenderness upon palpitation of his lower abdomen and bowel sounds hyperactive times 4 quadrants. His vital signs, BP 139/78, pulse 88, respirations 20, temperature 97.9. And he weighs approximately 143 pounds. His current plan of care includes the patient being admitted to an acute care unit for further evaluation, and the physician orders a CBC, BNP, blood cultures, a UA, and stool cultures, in addition to normal saline at 75 mils per hour and his current medication regimen. On day 2, routine blood cultures are negative, UA is negative. However, the patient's stool culture results indicate the patient's stool is positive for C. difficile. The physician orders Flagyl, 500 milligrams PO BID, and instructs the nurse to place the patient on contact isolation precautions. Okay, so students, let's discuss what's going on with Mr. Smith right now. And remember, I expect each student to actively participate. We are here to learn from one another. Each student brings knowledge, value, and new ways of viewing clinical situations which can assist other students with improving their practice to promote positive outcomes, okay? All right, so first of all, in reviewing Mr. Smith's lab values, what can students hypothesize is probably occurring with this patient?
Well, first of all, he's got an elevated WBC, and he does have a positive stool culture for C. difficile. This would appear that he has a gastrointestinal infection of some sort.
Great job, David. Yes, the physician does indeed diagnose the patient with C. difficile infection, a gut bacteria. Can anyone think of any other causes why the patient's WBCs may be elevated?
It might be tissue damage.
Could be.
Just another infection from a different location of the body, perhaps.
That is
Blood
correct.
cultures were negative, so
Mhm.
probably not systemic.
All right, fantastic, Angela and Ronki. Yes, other causes of elevated WBC could be aplastic anemia. Of course, this patient had no other signs and symptoms of that as far as his labs goes. Use of certain drugs and other inflammatory disorders like rheumatoid arthritis. Can anyone tell me what the normal value of WBCs is?
4,500 to 10,000.
Yes, that is correct. 4,500 to 10,000 per microliter. Alrighty. Why do you think the physician ordered contact isolation precautions for this patient?
Well, I think it's because the C. difficile is shed in the feces, and it's then transmitted to environmental surfaces that surround the patient, which can then become contaminated. And if healthcare workers and staff members are not careful, that can be transmitted to other patients and other staff members.
Exactly. And so when you're working with patients who are on contact isolation precautions, especially for C. difficile infections, when you're performing hand hygiene, what type of product, David, do you think you would want to use with this patient?
Soap and water.
Yes, and can you tell me why you would not use an alcohol-based hand rub?
Well, alcohol-based hand rubs are not effective against C. diff organisms. Only the soap and water is effective.
Very good, very good. Studies have shown that alcohol-based hand rub is not effective for killing bacterial spores. Okay, so we want to make sure we perform good hand hygiene with soap and water. Okay, let's see. Can anyone tell me what role does Mr. Smith's prior antibiotic usage have in the development of C. difficile?
Well, normal flora in the GI tract is disrupted with the use of certain antimicrobial agents, which can cause a decrease in the amount of healthy GI flora a patient has. The decrease in the normal flora allows for C. difficile, which is pathogenic in the gut, to multiply in the digestive tract. Ultimately, the decrease in normal flora and overgrowth of C. difficile infection becomes dominant. It produces bacterial toxins and it can damage the intestinal lining, which can cause severe inflammation and multiple episodes of watery diarrhea, sometimes recurrent, causing colonization potentially for the future of the patient.
So, can students tell me what risk factors does Mr. Smith have that predisposes him to developing C. difficile infection? Ronki, do you have any recommendations?
I can say the use of PPI, which is proton pump inhibitors, that can cause it, which reduces acid.
Okay, all right.
Well, he's over 65. He has a possible age-related decline of his GI tract function,
Okay,
and he's immunocompromised.
okay, all right, according to his labs, yes.
Also, recent consumption of broad-spectrum antibiotics.
That is correct. Actually, recent consumption of antibiotics is a #1 risk factors for patients in developing C. difficile infections. And there also is a high rate of reoccurrence in these individuals. So it's very important that we, as healthcare providers, that we are cognitive of antimicrobial stewardship when working with our patient population. Can anyone tell me what type of personal protective equipment staff should don prior to entering contact isolation rooms?
Gloves and gowns also.
Okay, gloves and gowns, exactly correct. And this is a bonus question that we will use for our next week's exam. So here's a little scenario. A nursing assistant asks you for help in bathing Mr. Smith. Upon leaving the room, you observe the nursing assistant performing hand hygiene with an alcohol-based hand rub. What would your initial response be to that nursing assistant? Or what can you do to promote good practice, good use of clinical practices with that student?
Well, I'd probably very respectfully ask the nursing assistant to perform hand hygiene using the soap and water instead of the alcohol, because your alcohol-based hand rubs are many times ineffective for killing C. difficile spores, once they begin to form that spore.
Great response. I think that's one thing that I'm very passionate about. I think it's important that as nurses, we promote positive behaviors, and when we observe staff not performing in an appropriate manner that can predispose other patients to safety risk, that we interject and that we try to correct that behavior in a positive manner, okay? Outstanding job, students. It looks like you definitely have met criteria 1 and 2 for our learning objectives. 3, we will assess during clinical rotations next week. Several of you will be surveyed next week on that. To summarize what we have learned today, C. difficile is a bacterial infection that damages the lining of the lower GI tract. It can cause severe inflammation and persistent episodes of diarrhea. In the case of Mr. Smith, his risk factors included age greater than 65, recent use of antibiotics, chronic use of PPIs, and age-related GI decline. Interventions to prevent transmission of C. difficile in acute care settings include placing patients on contact isolation, donning of personal protective equipment, hand hygiene using antimicrobial soap instead of alcohol-based hand rub. And also, in addition, I would encourage students to promote good hand hygiene among visitors and the patient's family members. That's really important as a nurse. If nursing students would like to learn more about C. difficile infections, I recommend exploring the Centers for Disease Control and Prevention website online. Thank you and have a wonderful day.